Okay, I will be talking about classification. Coming. So we'll be talking about the next classification of heart disease is the obstructive lesion types of heart disease. Of course, when they say something is obstructive, this thing is blocking something. Okay, anything obstructive is blocking something. So when you're talking about this classification, it's more of like you're just trying to look at the different lesions that fall under this category of obstructive. Okay, blocking blood flow in the heart. So obstructive lesions in the heart just refers to structural abnormalities. These ones, they tend to block or they restrict blood flow within the heart or major vessels. Now these lesions can be congenital or can be acquired. So they require surgery or catheter based interventions. So types of obstructive lesions in the heart, you have things like aortic stenosis. These ones, they narrow the aortic valve. Defects, they obstruct blood flow from the left ventricles to the aorta. Causes could be congenital or age-related calcification or rheumatic disease. Okay, so most patients with all those aortic stenosis, they present with chest pains, syncope, heart failure. Then we have pulmonary stenosis. This one is narrowing of the pulmonary valve. It will restrict blood flow from the left ventricle, from right ventricle to the pulmonary artery. Okay, so it's usually common in congenital heart diseases. Okay, so there's fatigue, there's cyanosis, there's right heart failure. Okay, then the next obstructive lesion is coarctation of the aorta. So this one is narrowing of the aorta, typically near the ductus arteriosus. Effect is to cause high blood pressures in the upper body, and there's lower pressure in the lower body. Okay, symptoms is headache, leg cramps, heart failure in infants. Then we have the subaortic stenosis. Okay, effects limit outflow from the left ventricle, so maybe discrete membrane or muscular ridge. Okay, so we have the supravalvular aortic stenosis. This one is narrowing above the aortic valve, so it's usually associated with what? Williams syndrome. Okay, then also have the mitral stenosis. This one is narrowing of the mitral valve, so it will obstruct blood flow from the left atrium to the left ventricle. So often it is associated with rheumatic heart disease, where the person is finding it difficult to breathe, the person is weak, and there's atrial fibrillation. Okay, then lastly we have the tricuspid stenosis. That one is narrowing of the tricuspid valve. It limits blood flow from the right atrium to the right ventricle. Okay, usually associated with rheumatic disease, and symptoms is what? Enlarged liver, that's hepatomegaly. There's accumulation of fluid in the stomach, that's ascites, and there's body weakness. All right, so that's a beautiful story we have around the obstructive lesion.